Hello, and welcome to the third presentation in Unit 2, Studying the Brain. In this presentation, we will briefly discuss different ways to study the brain. We will review how accidents can reveal information about the brain, and procedures such as EEGs, CAT scans, MRIs, PET scans, and functional MRIs can reveal information about the brain and its structure and function. Methods of studying the brain include accidents or brain injuries. The 1848 injury of Phineas Gage, railroad foreman. Apparently Gage was preparing to blast a section of rock with a tamping iron. The tamping iron was 43 inches long, 1.25 inches in diameter, and it weighed 13.25 pounds. While he was tamping, the rod shot skyward, penetrated Gage's left cheek, ripped into his brain, and exited through his skull, landing several dozen feet away. His personality profoundly changed as his prefrontal cortex was destroyed. While he did live through the injury, he was forever changed into an ill-tempered, shiftless drunk. In 2004, subject RH, who is a male, aged 36 at the time, had a traumatic brain injury, or TBI, which injured his frontal and left parietal lobes. As a result, he had serious language and writing deficits, known as aphasia for language and agraphia for writing. Of course, as an attorney, he depended upon his language and writing skills. Unfortunately, as a result, he could not practice law. There was an intervention called rhythmic entrainment intervention, or REI. What they did was they used music to enhance his concentration and his speech. As a matter of fact, his speech therapist said that REI had led to a performance improvement and a decrease in the subject's overall anxiety. Another way to study the brain is when it is in diseased form or with lesions. Brain lesions, even though they are not pleasant, do offer study opportunities. In the 1900s, prefrontal lobotomies were commonly practiced in order to control mental patients. This was a brain lesion created by man. Brain lesions can be caused by injury, infection, exposure to certain chemicals, problems with the immune system such as multiple sclerosis, and more. Typically, their cause is unknown. Lesions can be caused by internal abscesses, arteriovenous malformation, or AVM. Two possible lesions are cerebral infarction, or stroke, and cerebral palsy. Cerebral palsy is generally a lesion that occurs while the baby is in the mother's womb. This would affect motor coordination and can be mild to profound. In general, the mental function is not affected. Other ways to study the brain are the electroencephalogram, or EEG. EEGs can measure the brain's electrical activity with the placement of electrodes on the skull of the person being measured. An EEG is a tool we use to image the brain while it is performing a cognitive task. This allows us to detect the location and magnitude of brain activity involved in the various types of cognitive functions we study. EEG also allows us to view and record the changes in brain activity during the time tasks are being performed. EEGs are non-invasive and do not involve X-rays, radiation, or injections. EEGs have been used for many years and are considered to be very safe. The electrodes record activity without producing any sensation. A slight redness may occur in the locations where the electrodes were placed, but this will wear off after a few hours. However, there may be risks depending on your specific medical condition, so it would be prudent to screen for disorders such as epilepsy. Computerized axial tomography or CAT scan can render a three-dimensional picture of the brain. In computed tomography, the X-ray beam moves in a circle around the body. This allows many different views of the same organ or structure. The X-ray information is then sent to a computer that interprets the X-ray data and displays it in a two-dimensional form on a monitor. CT scans may be done with or without contrast. Contrast refers to a substance taken by mouth or injected into an intravenous line that causes the particular organ or tissue under study to be seen more clearly. Contrast examinations may require you to fast for a certain period of time before the procedure. Your physician will notify you of this prior to the procedure. A CT scan of the brain may be performed to assess the brain for tumors and other lesions, injuries, intracranial bleeding, structural anomalies such as hydrocephalus, infections, brain function, or other conditions, particularly when another type of examination such as X-rays or physical examination are not conclusive. Magnetic resonance imaging can give a very detailed image of the structures that inhabit the brain. Dr. Raymond Damadian, a physician and scientist, toiled for years trying to produce a machine that could non-invasively scan the body with the use of magnets. Along with some graduate students, he constructed a superconducting magnet and fashioned a coil of antenna wires. Since no one wanted to be the first one in this contraption, Damadian volunteered to be the first patient. When he climbed in, however, nothing happened. Damadian was looking at years of wasted on a failed invention, but one of his colleagues bravely suggested that he might be too big for the machine. A svelte graduate student volunteered to give it a try. On July 3, 1977, the first MRI exam was performed on a human being. It took almost 5 hours to produce one image, and that original machine, named the Indomitable, is now owned by the Smithsonian Institution. In just a few decades, the use of magnetic resonance imaging scanners has grown tremendously. Doctors may order MRI scans to diagnose multiple sclerosis, brain tumor, torn ligament, tendinitis, cancer, and strokes, to name just a few. An MRI scan is the best way to see inside the human body without cutting it open. For an MRI of the head, you lie with your head inside a special machine or scanner that has a strong magnet. The MRI can show tissue damage or disease such as infection, inflammation, a tumor, stroke, or seizure. Information from an MRI can be saved and stored on a computer for more study. Photographs or films of certain views can also be made. Positron emission tomography, or PET scan, is an imaging test that helps reveal how your tissues and organs are functioning. A PET scan uses a radioactive drug or tracer to show this activity. The tracer may be injected, swallowed, or inhaled depending upon which organ or tissue is being studied. The tracer collects in areas of your body that have higher levels of chemical activity, which often correspond to areas of disease. On a PET scan, these areas show up as bright spots. A PET scan is an effective way to examine the chemical activity in parts of your body. It may help identify a variety of conditions, including some cancers, heart disease, and brain disorders. The pictures from a PET scan can provide information different from that uncovered by other types of scans, such as CAT scans or MRIs. A PET scan or a combined CT PET enables your doctor to better diagnose your condition. PET scans can be used to evaluate certain brain disorders such as tumors, Alzheimer's disease, or seizures. Finally, there is the functional MRI or fMRI. Instead of creating images of organs and tissues like MRI, functional MRI looks at blood flow in the brain to detect areas of activity. These changes in blood flow, which are captured on a computer, help doctors understand more about how the brain works. Functional MRI is based on the idea that blood carrying oxygen from the lungs behaves differently in a magnetic field than blood that has already released its oxygen to the cells. In other words, oxygen-rich blood and oxygen-poor blood have a different magnetic resonance. Scientists know that more active areas of the brain receive more oxygenated blood. The functional MRI picks up this increased blood flow to pinpoint greater activity. The measurement of blood flow, blood volume, and oxygen is called the blood oxygen level dependent signal, or BOLD. Although the polygraph test works relatively well, scientists are in search of more accurate lie detection methods, one of which is functional MRI. In a study presented to the Society of Neuroscience, researchers gave subjects a playing card and asked them to lie about the card while undergoing an fMRI scan. When the subjects lied, certain decision-making areas of the brain lit up. This appears to be compelling evidence that the fMRI can pick up false statements, yet many researchers say it isn't proof that fMRI is an accurate lie detector, because areas of the brain that correspond to lying are also involved with a number of other thought processes. More research needs to be done on the technology to ensure that it won't falsely accuse the innocent based on misrepresented brain signals. If you would like references to this presentation, please send me an email. I will be happy to send it to you. Thank you for watching.